Good evening, everybody, and thank you for joining me. Just had a news report pop up on my phone. Local news station reported that a nurse had been attacked by a family member of a patient. The nurse was strangled and drug across the floor. Um, why does this keep happening? I mean, there was the nurse that was in Pennsylvania at UPMC that was attacked. In this incident, it was reported that the individual was on the radar of the um, internal security force of the hospital. And in my mind, if they were already on the radar, then they should have just been absolutely banned from coming to the hospital. Um, Usually, if you do something to be on the radar of police, that should just be almost an automatic ban. And maybe that actually would have prevented this incident from happening. And I actually saw it on NBC4i. So if you all want to actually head over there, NBC4i.com, I believe is what it is. Um, but why does this keep happening? And to top it off, per the report, the nobody in management or any other supervisor structure actually called to check on her, which is just sad, and that's a very commonplace thing in healthcare. These type of incidents happen, and nobody checks on the person that actually got injured, especially the healthcare workers. But we make sure we do everything for the patient or the family members or the people coming in, even the ones that perpetrate violence against healthcare workers. But this is again a letdown of multiple hospital systems, not just the one here locally where I live, but of all of them. There's a failure to protect staff. Again, that should have been a zero tolerance situation. The minute you are on the radar of your internal security or police force, you should be banned. I'm sorry. If it's that egregious where they've been called, you should be banned. I'm sorry. I know you want to be there for your loved ones, but it's no place for that kind of situation, and it may have prevented this violence from occurring to the healthcare worker. Thoughts and prayers, of course, go out to the nurse that is in the incident. I believe their union is going to be taking it up with the administrators and pursuing it, and I hope they do. And per the hospital statement that they're going to be reviewing their internal policy structure to make sure that this doesn't happen again. And in all honesty, it should have already been done. It's a failure on management and the hospital administrators to actually show any type of respect or dignity for the workers. Somebody from even internal management at the facility, like nursing operations, should have called and checked on them as a follow-up. And instead, there's nothing. And unfortunately, that happens pretty regularly. Remember, you are more than your job. And always, always, always watch out for your mental health and your safety while working. If you see something, don't tolerate it. Call security, document it, and then if there's a failure, that's on them. Take care. Have a blessed week. Bye.